If you're living with low back pain, in most cases, it's not actually caused by an issue in your low back at all. It's your hips. Let me explain. When you sit down an excessive amount each and every day, your hip flexors are going to adapt by getting short and by getting tight. In turn, this is going to pull your pelvis out of alignment, creating compression in your low spine. And this is the cause of your low back pain. In this video, I'm going to show you 3 versions of one single stretch, which is going to unlock your hips, free up your low back, and take you out of pain instantly. I'm Adam, and I'm the physical culturalist. And let me show you exactly what I'm talking about. So when you spend an excessive amount of time sitting down, your body is going to adapt by shortening and tightening your hip flexors, which are here, right? This in turn is going to lead to your pelvis getting locked in this tipped forward position. This is known as anterior pelvic tilt. So in order for you to stand upright when your pelvis is locked here, everything has to happen in the low back. And over time, this is going to lead to chronic back pain, a dull ache that most people are just living with. And if you try and solve the issue at the low back, you're looking in the wrong place. The problem isn't the low back, the problem is here. Once you can free up your hips, they can slide forward into that neutral position. You're going to be able to stand up a lot taller. There's going to be no more compression on the low back, and you're going to get immediately out of pain. And the good news is you don't need to do 1,000 stretches to do this. You need to do just one, and you need to do it right, and here it is. It's kind of ironic that the cause of your pain, which is the chair, is actually going to be one of the tools that's going to help you get out of it. This stretch is called the couch stretch, and I'm going to show you 3 versions ranging from beginner all the way up to advanced. Good goal for each stretch is to hold it for 60 seconds. Once you can do that and you feel like you're pretty comfortable, then you can move on to the next progression, right? So the first version is you're going to put your leg on the back of the couch, knee where you sit and the foot on the floor, and we're going to use the armrest to keep you upright and balanced. From here, we're just going to drive the hips forward. Now, it's important that we don't leave the hip behind, right? We want to squeeze this direction, keep this glute tight, be as tall as you can. One note, don't let the space here increase. You want to keep the ribs down, keep the glute tight, settle in. Now, any long duration stretch, there's a few things I want you to bear in mind. Number 1, I want you to relax your facial muscles. Number 2, I want you to control your breathing. If you send a signal to your body that this position is causing you distress by grimacing or holding your breath, then your body is going to tighten up, lock down, and you're not going to be able to get the tissues to relax and open up. So relax your face, calm down, hold this stretch for about 60 seconds. If it starts to feel good and you feel like you've got it managed, you can move on to the next version. Now, once we're in this position, we're going to scoop the hips forward. Make sure we keep the ribs down, so we're not going to lean back and compress the low back even more. Instead, we're going to stay tight here. Stay tight here. And whenever you're doing a longer duration stretch, it's important to relax. And the 2 ways you can really control that are by your facial expression. So don't grimace like you're in agony. And by your breathing. So keep your breathing very relaxed, very calm. If you don't do this, if you do tense up, your body's going to lock down. And it's not going to allow the tissues to relax and lengthen. So you have to send a signal to your nervous system that there's no distress, there's no discomfort, just breathe through it, and you want to hold this stretch for about 60 seconds. And then once it feels good, you can move on to the next variation. Next version, same position, but now the back knee's on the floor. Now we've got to bring the front leg up. This can be a bit more challenging for some people. Other than that, all the rules are the same. Relax, scoop the hips forward, stay upright, don't compensate in the low back. The final version of the stretch is the shin to wall. And although this is the same stretch as the previous 2 versions, its magnitude's more challenging. So take your time with this one, be patient, practice relaxation, and eventually things will open up and you'll be able to access this range of motion too. So we're going to put the shin to the wall. Now this actually adds an additional stretch for your ankle. So if your ankles are tight, this will help address that as well. We're going to post up the front foot, and then from here, the rules are the same as with the previous 2 stretches. We're going to push back, scoop the hips forward, make sure that glute is active, and make sure we're not compensating into the low back. Now this is good enough. If you want to go for the gold standard, it's back of head to wall. And just settle in and breathe. Just by unlocking your hips, you can address your low back pain at the root cause. And in a lot of cases, just a few days of this can be absolutely transformative to the amount of pain that you're living with. In general, you're going to want to do this stretch every single day. You're going to want to look at it like brushing your teeth. Just something you do. You don't need to change it. You don't need to get flashy. You just need to do it. If you feel like the information in this video was helpful, then please hit like. That way the algorithm will know to show it to more people who are looking for relief from back pain. I made this video with the intention of doing some good, of helping people get out of pain. And if you can help me with that, then I would truly appreciate it. Thank you so much for watching, and I'll see you in the next video.